Welcome, everyone. I'm really excited to welcome you to the Toilet Board Coalition's World Toilet Week virtual seminar. We have an amazing panel coming up here, and the subject matter is the future of sanitation is smart. And I can't even calculate how many IQ points are here on this panel together. It's amazing institutions and individuals who are putting their minds together around smart sanitation. And you might ask yourself, well, what does that mean? What is smart sanitation? At the Toilet Board Coalition, one of the things that we've been looking at is thinking about this incredible resource that each human being contributes every day. And that is all this information about health and about yourself in terms of like your well-being. Also at a city level, things that we might be able to imagine in the future about being able to help ourselves against infectious disease outbreaks. And so today's panel will bring together Rita Lohnhart from the Stanford School of Medicine at the Population Health Sciences. We have Kaval and Kelly from PSI. We have Carson Smuts from MIT. And we have Patrick and Jonas from the Zurich IBM Research Laboratory. So what I'd like to do is to have an interview style here and ask some questions. And the way that we're going to walk through this first is to think about what are some of the devices and tools that are going to enable this. Thereafter, we're going to think a little bit about what could one do with that information afterwards in a smart and secure and safe way. And then afterwards, we're going to think about some of the implications that would have about public health and enterprise and entrepreneurship. So welcome, everyone. Patrick, I'd like to start with you. IBM research is at the cutting edge of innovation, and smart sanitation is a new and emerging field. Could you describe sort of how you see the Internet of Things being a powerful engine in the smart sanitation transformation?
Hey, Michael, thanks for the question. Yeah, for sure, the IoT is at the backbone of what transformation can mean in terms of smart sanitation. I'm happy to let Jonas Weiss go into details on this question. So let's pass over to him, please, for this answer.
Okay, thanks. Yeah, indeed. We do see that the Internet of Things and associated technologies are really very strong enablers for many emerging fields, where particularly data-driven value chains rely on remote sampling, for example. They may range from novel servicing and maintenance schemes to environmental monitoring to healthcare and life science. IT is important, very important for IBM, and we already offer solutions and services for manufacturing and industries like water utilities, wastewater treatment, geospatial data visualization, and healthcare. We just consider smart sanitation as another very, very interesting use case, where with the off-shelf and new sensor types in combination with smart algorithms, new ecosystems can be established that actually benefit both individuals and societies. Does that answer your question?
Yeah, that's great, Jonas. Thank you. And I would like to, if you could, lead this out strong with some of the innovative work that you did, even with prototyping. So I think sometimes it's hard for people to visualize what could a sensor look like, or what it might even measure. And you and Patrick, did an initial prototype that could do some measurement. Could you talk a little bit, A, about the journey of that, and then B, some of the things that you were looking for when you first put this sensor together?
Yeah, I think with that, since Patrick has been the kind of one of the drivers particularly with the electrochemical sensing, and is really the sensor specialist among us, I'd like to give that question, hand over to Patrick for that. Is that okay?
Thanks, Jonas. So you addressed an interesting point, Michael. So in life sciences research, such as also the one going on in IBM research in the Zurich lab, usually one is interested in specific biomarkers, and it's mostly about diagnosing patients that are suspected to have a particular disease. And often the analysis of biomarkers requires, sample collection. You have to go to the doctor. There's some point of care devices that are being more and more established, but they're not yet commonplace. And we were brainstorming around this and figured that, there's an area where people routinely provide samples. In fact, it's so non-invasive that you can in fact perform tests or life sciences research in an area where sample collection becomes very trivial, and this is the sanitation context. So we were thinking about urinalysis and realized that a urine test is often a starting point for diagnosing the health of an individual. You know, this can be without actually knowing much about the individual's state of health at all. So it can be also used for, you know, exploring changes in health condition and so on. If you imagine sampling or performing a urinalysis test every time a person goes to the toilet, you can do this. You can do a pretty tight screening and accompany a person throughout the day, also in terms of getting a snapshot of his or her state of health. So in order to figure out if we could actually do this technically, if there was technical feasibility, we found it was actually quite simple to assemble a combination of off-the-shelf sensors, which are very cheap nowadays in terms of measuring color, for example, or temperature, and put in some of our own. Custom-built sensors that can measure ion concentration, for example, or pH in a very small form factor. We figured it was quite readily made, you know, to assemble these different types of sensors in a device that could actually be placed inside of a toilet even. So we prototyped that, and I don't know, Jonas, do you have a picture, or do you have the actual device?
I have it.
Which they can hold. Yeah, maybe you can hold that to the camera. So that's kind of the size. There are a couple of sensors inside of this white box. The white box itself is where the sensors come into contact with the sample, with the urine. It measures a couple of parameters such as pH, a few ion concentrations, also temperature, and the electronics box on the other end of the cable is then transmitting the data, and that's where it enters kind of the IoT world. So it's fairly easy to prototype sensors of this type, but I think what requires much more work is actually testing these types of solutions in the field, and I think that's where we can benefit from each other in terms of a smart sanitation collaboration.
Yeah, Patrick, first off, thank you. And Jonas, thanks for bringing it. I was absolutely mesmerized the first time that you shared that at World Water Week in Stockholm. It's the other thing I think that's proof of is if one can take a hacker's mindset, if you will, to this, you can see that there are pieces of the puzzle that are already available. Figuring out how to assemble them, I think, is the key part. And this, I think, is a natural segue to talk to Carson. So Carson, you know, is at the MIT Media Lab and has been a partner already beginning to test things in the field. And when we think about smart sanitation, people often think about what's in the toilet, but there's also the entire environment around the toilet, not only within the cabin, but the whole infrastructure. And so maybe, Carson, you could talk a little bit about the work you're doing and, you know, sensing cities and how something like smart sanitation could be part of a smart city infrastructure.
Sure. So the work we do at City Science at MIT's Media Lab is concentrated around sort of the development of cities and the incredible pace at which cities are obviously evolving at this current moment. Especially with people sort of being attracted back to urban environments for the various opportunities they provide. So we do a lot of mapping and spatializations of urban environments. We're particularly interested in the densification of urban environments and the diversity there within that comes about when that happens. When we spatialize environmental sensing, we're particularly interested in not just the environment sensing, but also behavioral patterns in the spaces we work, play, and live. And so it's the spaces between architecture and body that we can now, with technology, begin to explore in new ways, where we can begin to investigate the relationship between both the digital, being architecture and electronic infrastructure, and our own bodies, which are essentially analog skins. So for us, it's an opportunity to start to build or begin a conversation between these. We're particularly interested at the moment in investigating sort of different spaces within the live-work environment. We've looked at work, we've looked at play, we've even looked at things like kitchens, but we've really had an opportunity to investigate the sanitation space within our work-live environments. Why? Well, there's various reasons, but I would say that we're thrilled that there's now an opportunity for us to now bring that into our own research and begin to include architects and designers, not only in the sort of innovation workspaces we're developing, but bring them into the sanitation space as well.
Thanks, Carson. And one of the sensors that you have is an environmental sensor. Could you talk a little bit about what you call the termite and what it can do? And in the same spirit that Patrick described and Jonas described their sensor, a little bit about what this sensor can do and maybe some of the things we might be able to do looking forward as we envision what smart sanitation is and what it could be.
Sure. So for us, it's really important to include designers and researchers who are not familiar with technology in the process of data capturing in particular. And so we set out to develop a series of sensors called termites. The old versions were called mites. They stand for MIT Environmental Sensor. And as the name sort of alludes to, these things get embedded into architectural infrastructure. And what they can do is we use them to essentially measure things like, well, environmental aspects such as temperature, light, humidity, barometric pressure, carbon dioxide, and carbon monoxide. But also they have the ability to measure activity, motion, presence detection, and things along those lines that give us a better understanding of how people utilize space. In particular, we're really interested in sort of dwell space, where people spend their time in an urban context or within a building. And I think the biggest sort of challenge for us was to make these cost effective. So our primary goal was to make them really easy for designers and architects to use, sort of link it together with CAD software. So you can call up your CAD software with your three-dimensional model on a live site and have that information streaming across to sort of your team while you're designing in real time. And what we've set out to do essentially is also try to include individuals and students in the educational sphere. So we've worked with schools in Andorra. We're currently working with a school in South Africa, the University of the Western Cape, where we're using termites not only for our own research purposes, but to start to allow others to participate in that space, which has for a long time been somewhat exclusive to particular fields.
Thanks, Carson. You know, this is really interesting. So one of the things to note in the backdrop of sanitation is that this is a massive emerging economy, and there's going to be an incredible amount of sanitation infrastructure built over the next 10 years. So at the Toilet Board Coalition, we have a front row seat at that. And one of the things that we've talked about is how people build these things on a modular basis. And so having sensors that could be embedded in there that can help send out signals about health or, you know, use rates or monitoring and evaluation is a very powerful platform. So thank you for sharing that. One of the things that the Toilet Board Coalition has been looking at, and earlier we spoke about this with the city of Pune, is the city of Pune is going to be the world's first smart sanitation city. And one of the reasons why they're so keenly interested in this is that they're really interested in looking at how they can be ever more effective at public health. And also within India and in other places, people are combating infectious disease outbreaks. So actually, a network of smart toilets has the potential to be able to give humanity a jump start on combating infectious disease outbreaks. And so I'd like to turn this conversation to Rita Lohnart from the Stanford School of Medicine at the Population Health Sciences Center, and talk a little bit about that. And Rita, if you could talk to the mindset of what is it that people mean when they say precision public health?
Absolutely, and it's a really, really good question. So you hear a lot of these terms kind of bantered about, like precision medicine, precision health, precision public health. And I think most folks are familiar with the term precision medicine. which simply is a medical model that really proposes customization of healthcare. So that means that your medical decisions, treatments, practices, and products are being tailored to an individual patient. And this is all based on the amazing amounts of big data that we have available. Before, this customization was not possible. A lot of randomized controlled trials, as we know, are usually tested on white men, but now we know that the treatments that may have worked for a Caucasian male probably don't work for a Latino female. And so this is kind of the whole idea of customizing health for the individual. So that's precision medicine. But what if instead of a frantic race to cure disease once you have it, we can increasingly prevent disease before it strikes? And so this is how we define and think about precision health. So it's really what's happening outside of the hospital and outside of the healthcare system. And now to take it even a step further, you have precision medicine, precision health, which are really about the individual, but precision public health is about populations. And so essentially it's about delivering the right intervention at the right time, every time to the right population. So the unit of intervention has changed from that of an individual to that at scale, which is the population. And Stanford's really leading the way with this twofold. So we do it definitely in the healthcare space, but we also do it in education. And so one example from healthcare is that we're so excited about a collaboration that we have with Apple, which is doing this really innovative research study using data from smartwatches and from wearables to track heart rhythms, and including those from potentially really serious issues like atrial fibrillation, which we all know is a leading cause of stroke. And so these wearables and all this data that's being collected passively, we're being able to collect, and using techniques like artificial intelligence and machine learning, we can start to track not only the current outcomes with your physician and with the patient, but also that insidious onset of disease as well. So it's really proven to be a key tool empowering prevention, prediction, as well as treatment. So that's an example from the healthcare side. And then in education, we're really trying to change the conversation in the way that physicians and health professionals think about precision public health. So instead of focusing on the patient that's in front of you, more and more, we're seeing that doctors are becoming data scientists, and those that are the best of what they do really are the folks that can navigate the space between data science and being able to find out what works for their individual patient, but then also having that wonderful care at the bedside. And that combination is what we want to see in our students and health professionals moving forward.
Rita, thank you. You know, this is very enlightening. And one of the things that we, you know, as we just mentioned, you know, the city of Pune is really leading the cutting edge of this. And they're asking themselves, you know, how can we make the most effective use of this to be able to help people in this sort of precision healthcare way. And there's a report that will be coming out here shortly, which is our Smart Sanitation City Report, which you can find at www.toiletboard.org. Again, that's www.toiletboard.org, and it's our Smart Sanitation City Report, which helps outline what was done during this year in the city of Pune and some of the trends moving forward. And you had just mentioned AI. So one of the questions that I often get once people get that aha moment about smart sanitation is like, wow, that is going to be a lot of data. Can you talk a little bit about like how can AI be used, and what is Stanford doing with the big data core center that you already have as a framework, so people understand both that the information is anonymized but can also be made useful?
Right. So that's the biggest challenge that's facing folks now. So we are right on the precipice of collecting all these massive amounts of data. But if you're an individual or researcher that doesn't know how to work with this or harmonize it or curate it in a way that you can extract insights, it's relatively useless. So one of the core foundational, if I would go so far as to say the jewel in the crown of PHS is our data core. And so we've been going through and collecting and aggregating data sets across the world and putting a team together that offers concierge services to our researchers, investigators to help with this process, to try to harmonize data, put it in a way that people can access it, can link it, and start to draw out these really amazing insights. And so, as we know, artificial intelligence and machine learning, which is kind of a statistical method of AI, that is a way that we can kind of, what was done manually by a human before, now we can actually have algorithms and things to do it for us. And so it's a way to really before, where you would go through kind of a traditional pathway of a clinical trial. Now we can bypass that by running these algorithms and trying to extract these insights and know faster and quicker how an intervention at a city level could really make a huge improvement on health. So it's a really exciting tool and technique that we're starting to apply to these big and often very, very complex public health questions.
Thank you, Rita. And speaking of that, we have PSI with us today, one of the leading nonprofits in the world that thinks through public health issues. And we have Kelly and Kaval with us. And so I'd like to turn to Kelly for a moment. You've heard the speakers before you talk about these new technologies that are being introduced around smart sanitation and the capabilities that are there. But for you, what will these new technologies mean for global public health?
Yeah, great question. What a great conversation. I think that if we look across this group that's on the call today, many are bringing the devices, the tools, the technology, the data analytics, and we at PSI, to some extent, bring the fecal sludge and the reality of our work on the ground. PSI operates in 60 countries in health sector development. Unlike sort of a traditional NGO or non-governmental organization, our focus is purely on market development. So how do we build healthy market systems at the core of all of the work we do around the globe? Key to that is really sustainability. And so moving away from a traditional donor subsidy model, how do we develop these health markets that can sustain themselves on the long term? And I think that the conversation today really raises three critical pieces or three opportunities to drive towards sustainability in the sanitation markets. First, around our architect consumer. So we think of the consumer at the heart of everything we do, and every market-centric approach should always start with the consumer at the center. I think that if we talk about pushing past the data scientists and the doctors all the way to the consumer, ultimately, we can empower consumers via greater information and predictive analytics about their own healthcare needs. And so that is, that's our ultimate goal, is how do we push healthcare out into consumers' hands and give control to consumers over their own healthcare. I think that's going to be key to solving the world's health crises. Second around that is around the quality of the diagnostics and the predictive capabilities. Really, that is the key to cost effectiveness in every market. And so the diagnostic capabilities that we're talking about here, the predictive analytics that we've been referring to, can really raise the efficiency and lower the inefficiencies that are inherent in some of these systems. So I think that can have a huge impact on the market of sanitation. And finally, I think that the key question is, and one that we're just beginning to explore, is how can these capabilities and these tool systems and devices actually shift the supply and demand curve for sanitation services in markets globally? So what is it that can be built and layered on top of the provision of basic sanitation facilities that will enable us to overcome the extraordinary gaps in the provision of sanitation around the globe?
Kelly, thank you for that. What's interesting what you said is, layering this into efforts that have already been done. So sanitation is a challenging market, and you have done really great work to do market development. Maybe Kaval, you could take a moment and describe for us, an analog. Maybe there are some areas where you saw there were some challenges and you did do a market development, and how that could be an example of what we might see when we think about these diagnostic tools reaching the consumer in the field.
Sure. One of the projects that we thought about was in Bihar, India, where we realized that there were customers that we were missing, consumers that we were missing, specifically in the sanitation market, where there were consumers that wanted a toilet. And so for us at PSI, we were thinking, what is it that we can do? And where are some of the market barriers that we saw? And 4 things came out to mind. 1 was a lack of financing. 2 was an absence of affordable, desirable technologies, toilet technologies. The 3rd was around consumer behavior and open defecation. And the 4th was around a fragmented supply chain. And so us, with partners such as PATH, Monitor, Deloitte, Bill Gates Foundation, and Unilever, we kind of came together and said, what is it that we can actually do? And there were a few solutions that were remarkable for us. The first was around the social entrepreneurs, essentially Masons, who were really interested in starting and really expanding the kind of product that they had. And again, this is where the technology and the data is really essential in figuring out what is it that a consumer wants and how are they going to use this technology and what makes sense for them. So one part of the solution was training these social entrepreneurs. The second part, which is an important part, was around creating a sanitation financing fund that was for both consumers who wanted to purchase a toilet, but also for Masons and entrepreneurs and social enterprises that were interested in starting and expanding their business. And funding is an essential part of all of this. And so we had a fund, a revolving fund that allowed consumers to access this so they can buy toilets and purchase things that they really wanted and needed. The third was around strengthening the supply chain. In the project, we realized that, for instance, the cement rings weren't strong, the product wasn't good, and people weren't going to purchase that. So again, using data and technology, we found a product that fit the Bihar market specifically. And from there, we were able to strengthen the supply chain. And then the fourth was around an enabling environment, working with governments and partners to make sure that we were doing things that made sense, again, for our from an advocacy perspective. So there was a supply chain solution, a demand side solution, and then the enabling environment. So that was really important in making sure that this project was successful. At the end of the day, we built over 200,000 toilets, trained over 200 entrepreneurs, gave 35,000 plus in loans. And today the project is being replicated across India. And we're taking a lot of those insights and learnings across the country, and especially around data, looking at the consumer data, the operational data, the systems data, to help us make even smarter, stronger projects that are specifically filling up some of those gaps in sanitation in India. So that's a little bit of a kind of a market system approach that we took there at PSI.
And this I think is very useful for people to think about. So, you know, when the environment that you're describing is one where people go and collect sort of the different parts that they need to assemble a toilet for themselves. And so when one thinks about that, one can imagine a future where what Carson has spoken about, you know, embedded technologies and some of the materials become available. You can imagine, you know, the technology that already exists for remote logistics and management that Jonas mentioned earlier that IBM has capable in their water also being embedded. So often, you know, these are non-sewered sanitation solutions. So, you know, making sure that you know when they're working or not working, when they need to be cleaned or not, is something that one could look at with the kind of IBM technology that exists. And then when you think about add-ons, you know, and Jonas, if you could show that device again, I think that would be great. This is, again, something that one can insert or have that adapted to the respective toilet. So here, you know, and one thing that I find interesting about this was that, you know, the actual cost in this is the gray matter in Jonas's and Patrick's head. the device itself is something which is relatively affordable to make. So when one thinks about, you know, building that into a financing kit, I think that's also exciting. And then when you step back and you think about the kind of effort that Rita was talking about, you would also be able to think about this from an equity and inclusion perspective. So infectious diseases can come from anywhere. They could be from inside of a city, or it could be at a rural community. And if you do have some ability to have a wide enough network of sensors, we would really be able to, at any level, whether that be rural, peri-urban, or urban, have this smart sanitation network. And I think that the other thing that you had mentioned, Kelly and Kaval, is really thinking about the consumer. You know, one of the great potentials of this is for people to have command over their own health data. So one of the things that we're really excited about at the Toilet Board Coalition is what Rita had talked about earlier, which is precision medicine for everyone. It shouldn't be something that's, you know, skips out in the vast majority of the world. But in order to have precision medicine, you have to have a really good view into what's that baseline. So we're really excited about that. I want to thank everyone for joining this panel together. This is a group of people who are collaborating to make this a reality. For anyone who's listening who wants to join the Smart Sanitation Tribe, please start by looking at that Smart Sanitation City report that we have at www.toiletboard.org. find your way to us. In 2019, we're going to be doing some great advancements with the city of Pune and with the bright people that you had a chance to interact with today. So thank everyone, and thanks for joining us for this session.